Madam President, it's been less than 6 weeks since the President's health care initiative, the Affordable Care Act, was launched. The website's still not working, but the website will work. Actually, the website will be the easiest thing, in my view, that the administration will deal with as they try to solve the problems that are going to created by the act itself, and frankly, then the problems that are created by the website not working when we started. What we see happening already in this 6 weeks is that families are losing their current health care coverage. Certainly the cost, and example after example from my state of Missouri and across the country, appear to be going up at substantial levels for many families. A few families are lucky enough that they don't have much additional cost, but not very many. And a lot of families just simply are losing the coverage they've had, even though the president said, as we all have been reminded over and over again in recent days, if you like your health care plan, you can keep your health care plan. Apparently there are a whole lot of caveats on that weren't said at the time because people aren't able to keep their health care plan. The Associated Press reported that at least 3.5 million people have received cancellation notices. I heard somebody at the White House the other day said, well, these individual policies, that's only about 5% of all the people in the country. 5% of all the people in the country of millions and millions of people. And even if it wasn't millions of people, if you're one of the 3.5 million families that just were told your health care policy was canceled, 100% of your health care policies were canceled because you don't have one right now, or at least you're told you're not going to have one sometime between now and the end of the year. As millions of people are losing their plans, we find out that only a few thousand people have signed up. Reports apparently show that fewer than 50,000 people have been able to successfully get through this system in 6 weeks, a period where the estimate was 500,000 people. So far we have 50,000 people signing up, not 500,000 people. We have millions of people losing their plans, even though everybody was told if you like your plan, you'll be able to keep your plan. But it's estimated now that 7 million people were expected to get coverage by the end of March. Nobody any longer thinks that that's a number that will come anywhere close to being achieved. The American people obviously would like the president to figure out how to live up to the promise that you can keep the health care you have if you like it. A lot of people are weighing in. President Clinton, in the last day or so, has said he thinks we ought to figure out a way to keep the promise. Not a real reach. If this was not a promise just made one time and accidentally stated. This was a promise made over and over again. If you like your health care plan, you can keep it. If you like your doctor, you can keep your doctor. And we're finding that that's not true. So whether it's President Clinton who said we should figure out how to keep that promise, or there are all kinds of bills being filed in both the House and the Senate that would keep the promise. What I think we're going to find out is that there are lots of promises in the Affordable Care Act that aren't going to be kept. I think we already know that this has workplace impact that's not good. People going from full-time to part-time, people trying to keep their job numbers under 50 so they don't have to comply with the law. I've heard from many Missourians who have seen their hours reduced, who are seeing their health care premiums rise, seeing their options of insurance limited, their policies being canceled. They really deserve to have the people who've made this pledge now keep this pledge. The president, congressional Democrats who voted for the law, and there are very few laws you can say congressional Democrats who voted for the law, because this is a law that not a single Republican in the House or the Senate was for. And by the way, there were plenty of alternatives out there. High-risk pools would work better, medical liability reform, expanding the marketplace where you could buy across state lines, more reporting by healthcare providers of what they charge and what their results are. The idea that there was no other option that's widely repeated, that people who don't want to go down the Affordable Health Care Act don't want to do anything. Just simply not true. When I was a member of the House of Representatives, I filed a handful of bills, none of which were more than 75 pages long, that would deal with these rifle shot things that would have made the best healthcare system in the world work better. Wasn't perfect, but it was the best healthcare system in the world, and I think we're in danger of losing that. The president promised Americans, if you like your doctor, you can keep your doctor. Over and over again, that's not the case. The largest insurer on the Missouri exchange, on the exchange that Missouri voters have access to, doesn't include the largest hospital system. That means that thousands of patients won't be able to see the doctors or to go to the 13 hospitals of the largest healthcare system from the company that was their likely provider. This was the largest insurer and is at this moment the largest insurer in our state, the largest healthcare system, not part of their plan. Your insurance company, your hospital, your longtime doctor, all should be your choice, not the choice of some government-dictated healthcare plan. With only one other insurer selling policies in the region where this big hospital system is, people just aren't going to be able to be there. Many states have this same problem. Many states have options that don't include many of their hospitals or many of their healthcare providers. And people are beginning to look at this and not just be concerned about a violated pledge, but being concerned about somebody besides them interfering with a long-term relationship with the hospital you go to, with the doctor you want to see. Patients across the country are seeing and are likely to continue to see narrower and narrower networks available to them as insurers will try to keep costs down. With all of the new mandates in the law, one of the things they can control is they can negotiate with the people that would be available to see patients under their plan. And that's obviously what is happening. Smaller networks can require patients to travel further. People driving by the doctor's office that they went to for years to get to the doctor that they now have to go to. People passing by the hospital that their family may have gone to for generations to get to the hospital that now is the only hospital in their area available under the exchange. This is going to become the routine for Americans who aren't going to be able to keep the insurance they like. They're not going to be able to keep the doctor they like. In many cases, they won't be able to go to the hospital they like. Last week, I told stories of several Missourians who had pre-existing conditions and are going to lose those policies when the Missouri high-risk pool goes out of existence. Another thing we suggested in 2009 was let's look for ways to expand the high-risk pools and make them work even better. They were working pretty well. The problem was there was always a waiting list of how to get into the high-risk pool. That was the way to deal with pre-existing conditions. We're in a state like ours where 4,300 people are on the high-risk pool. They pay about 135% of the normal premium. That's a little more than the normal premium, but they're getting insurance after they got sick. And this is a high-risk pool where that has to work 135% for somebody who didn't have insurance until they got sick or lost their insurance after they got sick. That was probably a whole lot better than they're going to do right now, and they're finding out it's a whole lot better than they're going to do right now. One of the things we received this week was from Pam in Oronogo, Missouri, which is just outside of Joplin. Pam says that her oldest son, Aaron, was born with a medical condition where there's a buildup of fluid inside his skull. He had his first shunt surgery at age 18 months. Her family has a family business and held on to their insurance through the business as long as they could because they knew that no one would insure Aaron if they lost it. Now, that's obviously not a situation we'd want to see perpetuated. Aaron, however, was ready to go to the high-risk pool. After 10 years, their premiums had increased to $2,000 a month with a $10,000 deductible. And so they were able to get Aaron in the high-risk pool, and they were reasonably comfortable with that. But now, with the elimination of the high-risk pool, all of which closed on December 31 in every state in the country. With the elimination of the high-risk pool, Pam and her family have to go to the exchange for Aaron. Now, the exchange has to take Aaron because you can get in the exchange with 2 more minutes, unanimous consent?
Without objection.
Without getting in the exchange, even if you had a pre-existing condition. But what did they find in the exchange? They found that Aaron can no longer use his neurosurgeon from Kansas City, the surgeon he's used for years now. They can't buy a catastrophic policy that will allow them to have some choice and just pay some upfront cost on their own so they could have the doctor they're comfortable with. But they're where they are. The insurance they've had has gone away. The insurance they can get doesn't allow them to see the doctor that this young man has seen for years with a condition he's had his whole life. President also promised that premiums would decrease, and that's just clearly not the case. So I look forward to Missourians continuing to let us know the challenges they're having. I look forward to being able to share those on the floor of the Senate in the next few weeks. One of my constituents from Independence, wife came home. Their policy that had been costing $500 a month now is going to cost $1,100 a month. She's the office manager of an office with about 20 employees. Their insurance more than doubled. Unfortunately, these cases aren't the only ones I could talk about today. They're not nearly as limited as we would hope they would be. And people are finding out that the Affordable Health Care Act that wasn't good for the workplace is now turning out not to be very good for health care.